Hello, everybody. Welcome to Ms. McGuire video lecture. And today we're covering peripheral nervous system. So let's go ahead and begin. So what peripheral nervous system includes? All neural structures outside the brain and spinal cord. And those neural structures include sensory receptors, peripheral nerves and associated ganglia, and motor endings. So in this diagram, you can see a central nervous system or CNS that includes brain and spinal cord. Those cranial nerves, spinal nerves, and if you look at this like little bubbles over here, this is called ganglia. Now, ganglia is association of neuronal cell bodies. So when we have neurons, and I'm going to draw it for you. So here's a neuron. Neurons have dendrites and axons. So here's the second one. Now those cell bodies of neurons outside of the central nervous system form what we call a ganglia. So again, PNS includes sensory receptors, peripheral nerves, the ganglia, and motor endings. And motor endings innervate your effector organs, such as your muscles and glands. The peripheral nervous system includes sensory division. So sensory information moves in your peripheral nervous system and then to your CNS, central nervous system, and motor division. Now, another name for sensory division is afferent, and for motor is efferent. Now, motor division is divided in somatic nervous system that innervates your skeletal muscles and ANS, autonomic nervous system, that innervates cardiac muscles, smooth muscles, and glands. ANS is divided into sympathetic division that is active when you under stress. And it's not only mental stress, it can be just exercising. So that's called fight or flight response. And parasympathetic division that is activated when you are resting, for example, after a big meal. Because major organs of the peripheral nervous system are nerves, so let's look at structure of a nerve. It's a cord-like organ of the PNS. It's bundle of myelinated and unmyelinated peripheral axons enclosed by connective tissue. Connective tissue covering nerve include endoneurium. That's a loose connective tissue that encloses axons and their myelin sheath. So here on the picture, you can see axon that have a myelin covering, and then connective tissue covering around axons is endoneurium. Now, then those fibers organized into fascicles or bundles. Those fascicles covered by another connective tissue sheath called perinuria, coarse connective tissue that enclosed bundles of fibers into fascicles. And then entire nerve, and you can see nerve has the blood vessels inside as well. So entire nerve is covered by epineurium, that is tough fibrous sheet around entire nerve. Classification of nerves. Most nerves are a mixture. They are mixed nerves. They're a mixture of afferent and efferent fibers and somatic and autonomic visceral fibers. So most of the nerves inside that epineurium, you will find fibers that carry sensory information to your brain and motor information to your muscles. However, we have nerves that pure sensory. We call them afferent nerves, or pure motor or afferent nerves, but they are rare. Types of fibers in mixed nerve include somatic afferent and somatic afferent, visceral afferent and visceral afferent. Peripheral nerves classified as cranial or spinal nerves. Now, if nerves branch from the brain, we call them cranial nerves. If they branch from spinal cord, they are spinal nerves. Now, ganglia. Ganglia contain neuron cell bodies associated with nerves. So if you look at this diagram, this is your spinal cord. And on front, in anterior part of the spinal cord, you will find the structure called ventral root. Inside this ventral root, you have fibers, axons of motor neurons. So you carry information away from the spinal cord. In a dorsal root, you have fibers of sensory neurons. So you carry information toward the spinal cord. Also, you have this structure called dorsal root ganglion, where you will find cell bodies of sensory neurons. So dorsal root ganglia contains sensory bodies of the somatic and visceral neurons. Just making sure I didn't miss anything. Now let's talk about cranial nerves first. How many we have? 12 pairs. 12 pairs of nerves associated with the brain. Most are mixed. That means inside those nerves, you will find fibers of sensory neurons and motor neurons. And because they mixed in structure, they mixed in function. 2 pairs are pure sensory. Each nerve is identified by a number, 1, Roman numerals through 12, and a name. And here's a mnemonic to remember cranial nerves in orders. So the first letter of each word is the same letter that nerve begins with. So it's the first letter of the nerve. So let's look at mnemonic first. It's O, to take a family vacation, go Vegas after hours. Now let's look at the name and numbers of the cranial nerves. So the first cranial nerve is this one. So cranial nerve number 1, olfactory nerve. Now this structure is called olfactory bulb, and this is olfactory tract. The second nerve is optic nerve number 2. So here's the optic nerve, another optic nerve. Then they cross in the middle, and this area where they cross called optic chiasma, and then they continue as optic tract. Okay, number 3 is oculomotor nerve. So it's right there. Oculomotor means you move your eyes. Then 4 is a trochlear nerve. Also move your eyes, and we will look at structure and function in next slides. So that was trochlear number 4. Number 5, a large nerve, trigeminal. So here's the trigeminal. And by the way, those are pons. This is midbrain over here, and that's a medulla. So trigeminal number 5 originate from the pons. 6, abducens. Then we go 7, facial nerve. Then 8, vestibulocochlear nerve. Then 9, glossopharyngeal. Next is vagus, number 10. 11 is accessory, and 12 hypoglossal. Right, so you can see that most of the nerves associated with pons and medulla. Then we have 2 nerves from a midbrain, and this is from diencephalon, optic nerve, and olfactory nerves. They carry information to the temporal lobe, where your primary olfactory cortex is located. So now we will talk briefly about function of those cranial nerves. Olfactory nerves, number 1, arise from the olfactory receptors of nasal cavity, purely sensory function, so olfaction or smell. So where we find those nerves? So here's our nasal cavity. This structure called cribriform plate. Inside we have foramina, and through this foramina, see those nerves entering nasal cavity. So filaments of olfactory nerve number 1, then they connected to olfactory bulb and carry information of smell through olfactory tract to the cerebral cortex. Optic nerves arise from a retina. So here's your eyes, and a retina will be the deepest layer of eyeball. So you'll have retina inside, and from a retina we have optic nerves that pure sensory visual function, only vision, so only sensation. Now this is called optic nerves, then they cross in optic chiasma, continues further through optic tract and through this optic radiation to the visual cortex of the occipital lobe. Oculomotor nerve number 3, fibers extend from the ventral midbrain through the superior orbital fissure to the extrinsic eye muscles. Now those are motor nerve, right? So it's not sensory. So it's originate from the midbrain, anterior part of the midbrain. It moved towards the eyeball through the superior orbital fissure and innervates muscles that move your eye. Function in raising the eyelid, directing the eyeball, constricting the iris, and controlling lens shape. Trochlear nerve, also motor function. So it's fibers from a dorsal part of the midbrain. So remember, number 3 was from ventral part of midbrain. Those are from dorsal. And through the superior orbital fissure, it moves towards the muscle, and it's only innervate one muscle called superior oblique. Primary and motor nerves that direct or move the eyeball. So both oculomotor and trochlear moves your eye. Trigeminal nerve. Largest cranial nerve, fibers extend from pons to face. So here we have origin, so it's from pons, and it has 3 branches. That's why it's called trigeminal. And it has 3 branches and has 3 divisions. Ophthalmic, V1, maxillary, V2, and mandibular, V3. Conveys sensory impulses from various areas of the face and supplies motor fibers for mastication. So number 5 brings information, sensory information from your face. So for example, someone touches your face, or also if you have a toothache, your upper or lower teeth, if they hurt, they send information about pain or touch or other sensation to your brain through trigeminal nerve. And also these fibers of V3 innervate muscles that move your mandible. So that's going to be for chewing. Cranial nerve number 6, or abducens nerve. Fibers from inferior pons enter the orbits via the superior orbital fissure. So that's another nerve that innervates the muscles of the eyeball, that move your eyeball. And it's also innervate one muscle, lateral rectus muscle. Primary and motor innervating lateral rectus muscle. Facial nerve number 7. Chief motor nerves of the face with 5 major branches. Branches include over here temporal, zygomatic, buccal, mandibular, and cervical. So here's the 5 branches of facial nerve, and this is the motor nerves. So if sensation goes through nerve number 5, trigeminal, then to move facial expression, to move skin of your face, those muscles need to be innervated by cranial nerve number 7. Motor function include facial expression, parasympathetic impulses to lacrimal and salivary glands. So they also activate your lacrimal for your tears, the gland produce your tears, salivary produce your saliva. Sensory function, taste from the anterior 2/3 of the tongue. So not only, so that's a mixed nerve. So it's motor nerve to move skin. It's also sensation, taste from your tongue. Okay, so here you can see the nerve itself. So facial nerve, how it innervates your lacrimal glands over here. So you have sensation, you innervate tongue, and innervates salivary gland. It innervates sublingual, under the tongue, and submandibular gland. And over here you can see the motor branches that innervates muscle, right? So that's it. Those are sensory, and those are motor branches. Now, vestibulocochlear nerve number 8, efferent fibers from the hearing receptors, cochlear division, and equilibrium receptor, vestibular division, mostly sensory function. So the fibers bring information from your internal ear. Now, this part of internal ear called cochlea, and it's involved in hearing. So that's your cochlear division for hearing. So it carries information towards the brain stem. So it's a junction between pons and medulla. And of course, then it moves to your thalamus and to your cerebral cortex. And those branches bring information from this structure that's called vestibule and semicircular canal. And this is for equilibrium. So that's why it's called vestibular, because it's kind of like vestibule, cochlear nerve. So it's 2 nerves, and they fuse together and join your brainstem as one nerve, nerve number 8. 9, glossopharyngeal nerve, the only cranial nerve that contains all 4 types of fibers of wires. Somatic sensory neurons, so sensory information that reaches your consciousness, that you will understand from your skin, from your muscles. Visceral sensory neurons from your internal organs. Well, in in this situation from baroreceptors and chemoreceptors. So that's a visceral sensory information about your blood pressure and oxygen and carbon dioxide level in your blood, right? Somatic is taste from your tongue. And somatic motor neurons, that means it's innervate skeletal muscles, muscle of swallowing, and autonomic motor neurons, motor fibers to salivary glands. So it has all 4 fibers, the same as your spinal nerves. Your spinal nerves always have all these 4 fibers: somatic, visceral, sensory, somatic, and autonomic motor fibers. But in the cranial nerves, we kind of like always missing something, and nerve number 9 has all 4. Okay, so here's our glossopharyngeal nerve. Now look, at name itself, glossa means tongue and pharyngeal means pharynx or your throat. So you can see it's innervate parotid gland, like a big gland, the biggest salivary gland over here. It innervates your tongue. It innervates muscles of the pharynx for swallowing, and it innervates the blood vessels over here. Inside these blood vessels, that's a carotid, common carotid, and then it's split into internal and external carotid. And you have carotid sinuses here, where you have your baroreceptors and chemoreceptors for blood pressure and oxygen and carbon dioxide level in your blood. Vagus nerve, number 10. It's the only cranial nerve that extend, well, of course we have 2. That's why it says only cranial nerves. That extends beyond head and neck region. Millions of visceral sensory neurons from every internal organs from your chest and abdomen. Somatic motor neurons that permit the voluntary control over your vocal cords and your larynges, and autonomic motor neurons that control all the internal organs of the body. So if you look at this diagram over here, you can see that the vagus nerve innervates your larynx, right? So that's your larynx. So it innervates your larynx, muscles of your larynx, innervates your vocal cords. So those are skeletal muscle. It's also bring all the sensory information from your internal organs, from your lungs, from heart, from stomach, from liver, pancreas, kidney, intestine. All the sensory information moves to your brain through vagus nerve. And you do have some motor neurons that control the contraction of your stomach and intestine and gallbladder, right? So, and the vagus nerve is called major parasympathetic nerve of the body. So this nerve fires when you relax, and it's control your internal organs. 11, accessory nerve, formed from ventral rootlets from C1 through C5 region of the spinal cord, not the brain. So it's interesting, we still consider it to be cranial nerve, but it's not formed from, it's not branching from your brain. It's branching from spinal cord, from a C1, that's your C1 vertebra, through C4 vertebra, but it will be C5 spinal nerve. So look, all these rootlets, they mix together and they move up through the jugular foramen, or through the vertebral foramen, sorry. So they move up through the vertebral foramen, and then they move back down through the jugular foramen. So it's interesting. So now they thinking, should we still consider it to be a cranial nerve or spinal nerve? But for us, it's still cranial nerve, number 11. And it has motor fibers that innervate 2 muscles only, your trapezius muscle on the back and sternocleidomastoid. And then the last one, 12, hypoglossal. Hyper means below, glossal is your tongue. So fibers from the medulla innervate extrinsic and intrinsic muscles of the tongue and contribute to swallowing and speech. So hypoglossal is for tongue movement. Right, so okay. So those are our cranial nerves, and now we're moving to the spinal nerves. So we have 31 pairs of mixed nerves named according to their point of issue from the spinal cord. So we have 8 cervical, and we name them C1, C2, and so on. So total, we have 8 cervical. Even we have 7 cervical vertebrae, we have 8 cervical nerves. 12 thoracic, T1 through T12, 5 lumbar, L1, L5 through L5, 5 sacral, S1 through S5, and 1 coccygeal, CO. Right, so that's where it, so you're looking at your spinal cord, right? And then remember, spinal cord is divided in 31 segment, and from each segment you have pair of nerves that are branching from those segments. Did I say signals? Segments. So we have a segments, 31 segment, and on both sides we have 2 nerves, right? 1 pair of nerves branching from each segment. Okay. So spinal nerves roots. Each spinal nerve connects to the spinal cord via 2 roots. And dorsal and ventral roots unite to form spinal nerves, which then emerge from the vertebral column via the intervertebral foramen. Let me go back because just to remind you what those roots are, just very quickly, right here. So if you look here, you can see that this is our spinal cord, right? So now we have spinal nerve right there that emerge from spinal cord. But first it has 2 roots, right? Ventral root and dorsal root. And then when they unite, you forming spinal cord, right? So that's what it says, okay? And then, so the dorsal ventral root unite to form spinal nerves, and they emerge from the vertebral column through intervertebral foramina. So here's your vertebra. So this is vertebra on the top, this is vertebra on the bottom, and in between them we have like opening called intervertebral foramina, and this is where those nerves, spinal nerves, emerge from. Okay, then something happened with the spinal nerves. Each spinal nerve branches into rami, mixed rami. Rami means branches. So look over here. So here's our dorsal root, ventral root, and the spinal nerve is actually very short structure. And when it emerges from intervertebral foramen, it's immediately splits, look, into 2 branches here. Now, this branch that go to the front is called ventral ramus, or ventral branch. It's a bigger branch. And the one that goes to the back is dorsal ramus. Now, all these ventral rami, with exception T2, T12, form interlacing nerve networks called plexuses. We have cervical, brachial, lumbar, and sacral plexuses. So we will talk about plexuses in our next slide. But what happened with this ventral rami from T2 through T12? Well, they form over here a nerve that's called intercostal nerve. and they innervate muscles of the abdominal wall. So that's lateral, anterior abdominal wall. And dorsal ramus moves back and innervates muscles of the back. Now, if you forgot what is this T2, T12, let's move back over here. And here's our cervical nerve. So they innervate above C1, below C1, right? Below C2, below C3, below C4. All right, so that's called C1 through C8 cervical nerves. Now we have thoracic vertebra. Remember, we have 12 thoracic vertebrae. So, for example, we have T1, and below this T1, we have T1 nerve. Then we have T2 vertebra. So below T2 vertebra, we have T2 nerve. So this nerve from T2 through T12, they don't form any plexuses. They just go to the front and they innervate a muscle of the thorax and muscle of the abdomen. The ventral ramus. The dorsal ramus goes back and innervate back muscles. But in the cervical region over here, look, it's forming like a network. You see how they making this mass? They all interconnected. Now look what happened in the lumbar. Look what happened in the sacral region. You see how we don't have this individual nice nerves running to the front and to the back? We have a network of nerves. Those are called plexuses. Now, why do we have those plexuses? Because this is where we have more muscles, muscles of the neck, muscles of arms, legs. So if you have more muscles, you need more nerve to innervate them. That's why we form plexuses. So now look at these plexuses. First, cervical plexus, formed by ventral rami C1, C4. So here's our nerve C1, C2, C3, C4, and some fibers from C5. Instead of just having one branch, one ramus that kind of like moves towards the neck, we have all these branches that mix together, forming a network. That's what plexus is. This plexus then have nerves that originate from the plexus, and those are peripheral nerves, right? So those are our peripheral nerves. So we have spinal nerve first, then we have our ventral ramus, then we have plexuses, and then peripheral nerves. So nerves that arise from cervical plexus innervate skin and muscles of the neck, ear, back of head, and shoulders. And one important nerve that is formed from this plexus, so it's branches from the cervical plexus, is phrenic nerve. It's a major motor and sensory nerve of the diaphragm, and it receives fibers from C3 through C5. So these fibers C3, and we also adding C5 over here, they form this important nerve in your body that moves down and innervate your diaphragm. So phrenic nerve. Brachial plexus, formed by ventral rami C5, C8, so all the cervical plus T1. And sometimes T4, sometimes T2. It gives rise to the nerves that innervate the upper limb. So here's the plexus, right? So here's the plexus. And from this plexus, we have our peripheral nerves. So let's look at these major nerves. Axillary on the back and radial. They shown here in green color, and both they are in the posterior compartment of the arm. And radial is on the side where you have your radius, this bone called radius. Now over here, kind of shorter nerve is called musculocutaneous. Now this long bone on the ulnar side is ulnar nerve, and so that's a radial. That's the ulna, and between them you have median nerve. So that's a major peripheral nerves that innervate muscles and skin of your upper limb. So musculocutaneous innervates biceps brachii, brachialis, and skin of lateral forearm. Median innervates skin, most flexors, so they are on the anterior part of your arm and forearm, pronators of the forearm, and some intrinsic muscle of the hand. Ulnar supplies the flexor carpi ulnaris, part of the flexor digitorum profundus, most intrinsic muscle of the hand and skin of medial aspect of head, because it's on the ulnar side, right? So no wonder it's on the skin when it's that it innervates is also on the medial side. Radial innervates essentially all extensor muscles, so they on the back of your arm and forearm, supinators and posterior skin of arm and forearm. Then we're moving to the lumbar plexus. So from L1 to L4. Remember, we don't have anything from T2 to T12. T2, T12 do not form plexuses, but it form intercostal nerves. Lumbar plexus innervates the thigh and abdominal wall. Major nerves, femoral nerve, and femoral is really like a short nerve over here. And then we have many other nerves that branch from it. Now this long one, a superficial nerve, is saphenous. So femoral innervate quadriceps and skin of anterior thigh and medial surface of the leg, because that's saphenous on the medial side, and it's a sensory nerve. And obturator, remember this opening over here, this foramen, it's called obturator foramen. So the nerve that goes through this foramen is obturator nerve. Obturator nerve passes through obturator foramen and innervate adductor muscles. And where our adductor muscles? Right here on the medial surface of the thigh. Sacral plexus. Now we're moving down, right? So here's the sacral plexus. L1, S4. Serve the buttock, low limb, pelvic structure, and perineum. And perineum is the area between external genitalia and anus. The major nerve, the biggest nerve in your body is sciatic nerve. So here's the sciatic nerve. It's the longest and thickest nerve of the body, innervates hamstring muscles, adductor magnus, and most muscle in the leg and foot. So here's your hamstring group, right? So you have three muscles here, bicep femoris, semimembranosus, semitendinosus. So that's innervated by sciatic nerve. And a sciatic nerve, when it approaches popliteal region behind your knee, it splits into two. One goes straight down, and it's a tibial nerve. And another branch is called common fibular, because it's go to the lateral side. It go to the lateral side, and it's called a superficial fibular, and then it's go to the front, called a deep fibular. And those nerve, tibial nerve, innervate posterior muscles of the leg. Superficial fibular innervates fibularis muscle, longus and brevis on the lateral side, and deep fibular innervate anterior muscles of the leg. Okay, now innervation of skin. Now here, what I want to remind you, look, when we're talking about plexuses, so let's look at this plexus one more time, brachial plexus. So for example, you say like, okay, well, here's my, for example, ulnar nerve, right? So here's my ulnar nerve. Now, this nerve is spinal nerve, right? So what spinal nerve is that? Is it spinal nerve C4, C5, or maybe T1, or maybe, I don't know, C7? So what's, if this considered to be your peripheral nerves, right? And it's a spinal nerve. So what spinal nerve is that? But actually, there is a lot of fiber from different spinal nerves. So it's from C5, C6, C7, C8, right? So those fibers, all these fibers are mixed first, and then they form your ulnar nerve, right? That makes sense? And so when you innervate your muscles, kind of like many spinal nerves are involved in innervation of one muscle, but it's not the same with your skin. Skin innervation is different. They are innervated, particular part of your body, particular part of your skin, I would say, innervated by one cranial nerve. So your body, your skin is divided into area called dermatome. This is area of skin innervated by cutaneous branches of a single spinal nerve. All spinal nerve except C1 participate in dermatomes. So if you look over here, this part of the skin innervated by C2. So if patient doesn't have sensation in this area, you know C2 is damaged. This is C4. This is, for example, T8. This is T12. This is L4. And it's very complicated map, but medical professionals who use it in their practice, they learn this map. And when they have a patient that losing sensation in some part of the body, they can predict what spinal nerve is affected, right? So those are innervation of skin through dermatomes. And as I said, it's different from our peripheral nerves that innervate your muscles, because muscles of your arm and your leg, they have fibers from several spinal nerves, when dermatomes have fibers for one single spinal nerve. Oh my goodness, thank you very much for watching. I want to remind you that that was the peripheral nervous system, and I hope it was helpful.